I think our president deserves applause for what he's been able to do. Your Excellency, we are proud in Nairobi, in SHA. Mheshimiwa Moses Kuria was giving me an analogy because of the numbers we have. The most tech-savvy country in the world is Estonia, where we go to benchmark. The people registered in Nairobi and SHA are 2 times the population of the whole of Estonia. More than 3 million people registered and more than 1 million actively paying every month. And through the DHA dashboard, I can see who is self-employed, who is employed, and how they are doing. So we really thank you. And want to really congratulate Mheshimiwa Duale. You have really led the way in healthcare. Your PSs, Oluga, who we are very proud of as Nairobi, and PS Mary Mudhoni. Allow me to also salute the thousands of community health promoters across the country who are bringing healthcare to the people. Before, we used to tell the people to go to hospital. These days with the CHPs, the hospital is going to the people. And that has reduced greatly the cost of health service delivery in this country. I'm sure that investment can be quantified by our minister and by the team here. Your Excellency, allow me at this juncture to invite the chairman of the Council of Governors to also come make his remarks and introduce the governors, the many governors who are here. Your Excellency, we have members of parliament, we have senators I can see, we have members of the National Assembly. I hope at some point they'll also get full recognition and introduction by the minister as he comes. Tupigie chairman wetu makofi tafadhali.
Your Excellency, Dr. William Samoei Ruto, CGH, the President of the Republic of Kenya and Commander-in-Chief of the Defense Forces, Your Excellency, Honorable Professor Kindiki Kithure, Deputy President of the Republic of Kenya, Your Excellency Dr. Moses, Your Excellency Dr. Musalia Mudavadi, Cabinet Secretary, Prime Cabinet Secretary, and Cabinet Secretary for Foreign Affairs, Your Excellency Dr. Moses Wetangula, Speaker of the National Assembly, All Excellency Governors, Cabinet Secretaries, PSs, Members of Parliament, development partners, ladies and gentlemen. Your Excellency, it's a great honor to join you at the Kenya Health Summit 2026 on behalf of the Council of Governors and the 47 county governments. I wish to appreciate the Ministry of Health for convening this important summit and for the continued engagement with county governments in advancing the health agenda of our country. The theme of the summit, Reform Delivered, Health as a Right, speaks directly to the responsibility we carry as leaders. Health is not simply a sector of government, it is a constitutional right and a fundamental determinant of social and economic well-being of our people. Your Excellency, we meet here more than 16 years since the promulgation of the Constitution of Kenya 2010, which fundamentally transformed our system of governance. The evolution has evolved from a constitutional aspiration into one of Kenya's most consequential governance reforms. Today, Your Excellency, our emphasis is that we can do so much for Kenyans in the health sector through coordinated intergovernmental implementation, functional service delivery, and measurable patient outcomes. And I want to confirm on behalf of the COG that we have actually achieved so much in the space of healthcare. We have achieved tremendous results over the past 4 years through your leadership, Your Excellency, and through the bottom-up economic transformation agenda, BETTER, which prioritized universal health coverage for all Kenyans. I wish to highlight, but just a few areas that demonstrate the progress we have made and equally the work that remains before us. In primary health care, over 107,800 community health promoters, CHPs, were deployed under a 50-50 shared financing model between the national and county governments. This has expanded health service availability at the primary level. Primary care networks, PCNs, have increased from 89 to 277. On health financing, Your Excellency, since the inception of the Social Health Authority, counties have cumulatively received 46 billion shillings, out of which 31.4 billion has been paid to hospitals through the Social Health Insurance Fund, SHIF, and 14.2 billion has been reimbursed to primary health care facilities. 98% of public facilities have been onboarded on the Social Health Authority, SHA. Through collaboration between the two levels of government, 32.4 million people have been registered under the Social Health Insurance Fund, representing a significant increase from the 7 million people previously registered under NHIF. Counties have also strengthened emergency response with 304 of our ambulances out of the 506 that we run currently already integrated into the National Ambulance Dispatch System, improving referral linkages and timely response to patients requiring urgent and specialized care. Your Excellency, through your initiative under the National Equipment Service Program, NESP, the county governments have now specialized equipment at all levels. This has gone a long way in improving the capacity of counties to handle critical patients and other access to specialized care. We now have MRIs, ultrasounds, blood equipment, blood chemistry equipment, you name it, in the most peripheral of places, Your Excellency. Through the UHC reforms and digitization, the Digital Health Authority has been able to distribute 42,300 digital devices across level 2 to level 5 facilities, processing SHA claims in all 47 counties. These are but a few areas that the reforms in the healthcare sector have greatly improved. Your Excellency, this summit is about consolidating gains, celebrating what we have achieved, taking stock, and charting out the way forward on what else needs to be done. We acknowledge certain challenges, especially in workforce gaps and industrial relations, and together we will work to solve those. Your Excellency, as the Council of Governors and the 47 county governments, we reaffirm our commitment to working with the national government, development partners and the private sector, civil society, health workers and communities to consolidate the gains thus far and to address the gaps that remain, as I said. Let this summit mark a renewed phase of cooperative governance, shared accountability, and accelerated implementation. Let's build on what has worked, confront what has not, scale innovation emerging from both the national and counties, and ensure that our reforms are felt where it matters, as it's already happening. Together, let's deliver a resilient, equitable, responsive, people-centered health system where quality healthcare is not a privilege but a right for every Kenyan in every county, and at every level of care. Your Excellency, I want to conclude by observing that I have had politicians out there saying that the first thing they will do if they get into office is to scrap SHA. Your Excellency, actually one politician said, on day one, I'll scrap SHA. To replace with what? Your Excellency, your administration is doing its best to fix everything. I think what we have failed to fix as a country is the toxicity of our politics. I want to confirm that hospitals in the most peripheral of places today receive funding directly from SHA. And in many cases, and I've said this before, the challenge we have as governors is to control what they do with that money so that they're not using it to just do more pavements and more renovations, but use it to things that can actually help patient care. This would not have been achievable without SHA, Your Excellency, and without all the policy changes. Your administration has thought through everything from financing to policies to digitization, and as a council, we appreciate the partnership that we have. Your Excellency, let me just take a minute to introduce the governors who are here. Excellency Governors, you may just stand where you are. I hope I can see you. Thank you very much. From the very end there, we have Professor Barchok, Governor Bomet. We have Governor Gladys Wanga, Governor Homa Bay, Gideon Mungaro, Excellency, Governor of Kilifi, Fatuma Achani, Governor of Kwale, Governor, I call him Kipiego Arapsang, Governor of Nandi. We have Governor Simba Arati. We have our Chair of Health, Governor Abdul Samad Sharif Nasir. And we have Governor Wesley Rotich, Governor of Elgeyo Marakwet. And we have Governor of Nairobi, our host. Your Excellency, I want to end by saying that we look forward to very engaging deliberations for the next 2 days to discuss where we are, to consolidate gains, to appreciate ourselves that actually we have achieved a lot. And for those saying that they will scrap SHA, it's akin to telling us that they will destroy the roads that have been tarmacked once they get into office. I end it there. Thank you, Your Excellency.
Thank you very much, Your Excellency. Before I call the next speaker, I would kindly request the PSs who are in the house to stand up and just wave to the crowd. We have PS Mohamed Dagar, Transport, PS Judith Pareno, Justice, PS Ismail Madei, Special Programs, PS Hariki Mutai, Mining, PS Beatrice Inyangala, Higher Education, PS Idris Dokota, Cabinet Affairs, PS Joel Oromonyang, Public Works, PS Ann Wangombe, Gender Affairs, PS Karen Agengo, Children's Services, PS Cyril Wagunda, Public Investment, PS Joseph Mutari, Social Protection, PS Aurelia Rono, Parliamentary Affairs, PS Abubakar, Investment, Susan Mangeni, MSME, and PS Jacobs Fikirini, Youth Affairs. Oh, and our SG, Solicitor General for the Government of Kenya. Your Excellency, transforming healthcare requires bold leadership and a steadfast commitment to delivering comprehensive reforms. I now would wish to, it's my distinct honor to invite my Cabinet Secretary, Honorable Aden Duale, the Cabinet Secretary for Health. A round of applause.
Your Excellency, the President of the Republic of Kenya and the Commander-in-Chief of the Defense Forces, Your Excellency, the Deputy President, Professor Kindiki, Your Excellency, the Speaker of the National Assembly and the Head of the Legislature, Speaker Moses Wetangula, Your Excellency, our Prime Cabinet Secretary, Honorable Musalia Mudavadi, Your Excellency, the Chair of the Council of Governors, Governor Abdullahi, Your Excellencies, Governors present, Cabinet colleagues, Your Excellency, the Cabinet Secretary for Housing, my sister Alice Ohome is here, the Cabinet Secretary for Tourism, Rebecca Miano, the Cabinet Secretary for Gender, the Cabinet Secretary for Environment, the Attorney General, my brother, the Cabinet Secretary for Sports, the Cabinet Secretary for Energy, the Cabinet Secretary for Education, the Cabinet Secretary for Water and Irrigation, and the Cabinet Secretary for Labor. Your Excellency, allow me also to recognize the chairs of our Parliamentary Health Committee, the Senator Mandago, the chair of the Health Committee from the Senate and the entire leadership, Dr. Nyikal, the chair of the National Assembly Health Committee. Your Excellency, allow me also to recognize the entire leadership of the Ministry of Health at the national level. Allow me also to recognize the entire leadership from the CECs of our entire 47 counties who are present here, civil society representatives, NGOs in the health sector, our development partners in the health sector, our diplomatic representatives who are here, a number of diplomats are here. Your Excellency, the heads of health agencies, health workers, citizens who are here this morning, allow me to welcome you and every delegate to the Kenya Health Summit 2026. This is the largest gathering, Your Excellency, of Kenya's health sector ever convened in this republic, and it is fitting that it takes place under the theme that is a statement of fact rather than a wish. Reform delivered, health as a right. Your Excellency, in August of 2022, the people of Kenya were offered a choice. They were not offered slogans. They were offered a plan, written down, published, in which universal health coverage stood as one of the 5 pillars of our national transformation. Kenyans read that plan and they give it their mandate by electing you as their 5th president. 4 years later, we have come to this hall to do something that is rare in the politics of our country and in our region. We have come to place that plan side by side with a record and to invite the whole country to compare the two. And I want to say something about why this was possible, because it is not a technical story we want to say. It's also a political one. Every government that has ever governed Kenya knew what was wrong with our healthcare system. The diagnosis was never a secret, but it is set in reports. It was found in commissions. It was found in expert panels, in the exit notes of the departing officials, including presidents. But what was missing was also never the analysis. What was missing was a head of state willing to spend the political capital. Your Excellency, in the first year of your administration, you chose to retire an institution that has served this country for nearly 6 decades, that employed thousands, that had a constituency of its own, that has defeated the reforming intentions of every government before you. You were advised, and I know because some time is set in those meetings, and it could have been safer for you to amend, to have been safer for you to postpone or to pilot the way some of your predecessors have done, or to appoint yet another task force. You declined all those offers. You went to Parliament as our president, and you asked for the 4 new laws. And that's why the Speaker of the National Assembly and the Committees of Health are here. And when the transition proved difficult, as deep reforms always do, you did not retreat into silence. You went out and explained it publicly in every county in this republic. And that's why we are here today. Not because the Minister of Health is clever, but because this reform had a political ownership at the very top, sustained for 4 years, and the technical machinery built deliberately underneath. Your Excellency, you will shortly place before this nation, is not my duty, the full account of universal health coverage known as Taifa Care. You'll tell the country the coverage we have done. You'll tell the country the contribution, the payments, and the outcome. And allow me, therefore, Your Excellency, to report to this summit on 3 matters that fall directly to this ministry and which determine whether any of that money ever becomes care, the medicines, the equipment, and the people. Your Excellency, a health system on health commodity security. A health system is only as credible as the medicine on its shelves. When this administration came into office, the national order fill rate at Kenya Medical Supplies Authority stood at 35%. In plain language, a facility that ordered 10 essential commodities received fewer than 4. Today, that rate stands at 95%. We restored the authority's balance sheet by recapitalizing KEMSA through 10 billion shilling credit facility arranged with one of our commercial financial institutions. And we did that because there's no supply chain in the world that functions without working capital. We have operationalized the Embakasi Supply Chain Center. We have strengthened our regional distribution hubs in Kisumu and Mombasa. And we have moved the entire chain from paper to platform. Your Excellency, today KEMSA supplies more than 11,400 health facilities, and 54% of everything it distributes goes to primary health care at level 2 and level 3, the dispensaries and the health centers, where most Kenyans seek care. What this means for an ordinary Kenyan, Your Excellency, is very simple. The mother who walks to a dispensary with a prescription in her hand now finds the medicine at the end of the queue, and not a referral to a chemist she cannot afford. On National Equipment Support Program, equipment, Your Excellency, because a clinician without a diagnostic is a clinician guessing. Under the National Equipment Support Program that you introduced as one of the key pillars of universal health coverage, as of 30th July 2026, we have installed medical equipment valued at 9.68 billion shillings in 251 health facilities across our 44 counties, showing 239 county facilities and 8 national facilities. Let me be very specific about what that means at the bedside. It means 36 CT scans, it means 2 MRI machines, it means 52 digital X-rays, and it means 72 ultrasound machines that have been provided. Consider what that changes. Not long ago, a Kenyan who needed a CT scan had 2 options: travel to Nairobi or go without a diagnosis. Today, that equipment is available in the great majority of our counties, and it's paid for by Taifa Care, not by the national government and not by our county governments. Over the last 4 years, this government has deployed 24,573 healthcare interns to all the 47 counties, Your Excellency, at an investment of 19 billion shillings. An annual placement has risen from 3,373 in the financial year 2022-2023 to 6,800 in 2026, nearly doubling the single admission for our young graduates from our colleges. This has allowed young Kenyans who for 4 years ago could have completed their training and go home to wait, get a placement. We have also sponsored 262 medical registrars across 35 specialties, so that counties who have never had a single specialist are now growing their own. We have released 3.5 billion shillings to settle the accrued basic salary arrears owed to our doctors. Under your direction, we are employing 5,000 additional nurses and midwives are being recruited. All this happened under your leadership, Your Excellency, in the last 4, and we will showcase them as the 2-day health summit progresses. Your Excellency, allow me now finally to acknowledge our partners in this work. To our Excellencies, the governors, health is a devolved function, and every figure that will be quoted in this hall was earned in a county facility by a county staff. This reform has been a genuine partnership between the 2 levels of government, and I want to thank our governors for that. To our development partners who have stood with us, Kenya, through a very difficult period of global health financing, thank you for the confidence you have shown in our healthcare system. To our private and faith-based providers, our professional bodies, our unions, you are inside this system, not outside. And this reform is stronger for your involvement. And to the Kenyan healthcare workers who are here and those who are listening to us, who are the reason any of this, who are the reasons that a patient reaches them at any time. This government sees you. Tomorrow, this summit devotes an entire plenary to your future. Over the next 2 days, Your Excellency, we will do an examination of our healthcare financing, primary health care and community health, human resource for health, health products and technologies, health security, digitization of the healthcare system, and our specialized and referral services. Her Excellency, the First Lady, will do a session tomorrow on maternal and newborn health at the plenary. We will have the Deputy President who will run another plenary tomorrow afternoon before we have a joint plenary where we want to listen to the people of Kenya, and His Excellency the President, as a listening leader, will be sitting in that forum. Your Excellency, just to conclude, tonight we have the Town Hall Health Summit. And we want to answer all the questions. We want to answer all the questions concerning the healthcare system in Kenya. We want to answer all the fake headlines